So my primary research goal is to help develop more novel diagnostic techniques for the detection of what are known as superbugs, or bacteria that are resistant to important kinds of antibiotics. One of our concern is the increasing rates of infection that we are seeing in children.
We think, at the individual patient level, it's important to know when they're becoming colonized with organisms that are resistant to antibiotics, because we think that will help us modify their treatment. Either before they get sick or after they get sick, it will help us treat them most appropriately. But in a broader sense, understanding which patients carry these organisms can help us prevent their spread. And so we think the ability to detect patients or detect organisms with resistance allows us to keep them in check and prevent them from spreading to patient.
Our research is looking at the use of next generation sequencing, particularly using shotgun metagenome sequencing, to evaluate the microbiome that's in the intestines in humans. And this type of technology allows us to also look at the antibiotic resistance genes that can be found within the intestines.
Well, when I took a look at the data from Drs. Haslam and Anderson, I realized right away that with this type of multidimensional data and a relatively small sample size, a lot of traditional statistical approaches would fail. This is the kind of data that pretty much needs to be analyzed with machine learning approaches. For that type of approach to work, you really need some serious computing power. And so I naturally turned to the Ohio Supercomputing Cluster because I knew we had access to this incredible resource.
In the greater public health sense, understanding how these organisms are spread and what contributes to their dissemination through a community, I think is very important in trying to decrease overall rates of antibiotic resistance.